Hello. From today, I am Dr. Sanjay Kumar Rai. We'll talk on the drugs related to autonomic nervous system. Today, I will talk on the cholinergic agonist drugs, and the following short videos will be related to the other groups of drug and their mechanism of action, their indication, contraindication, and side effects. Before going to talk on cholinergic agonist, we should know how the parasympathetic nervous system works. This is the preganglionic nerve terminal, and this is the postganglionic nerve terminal. When an impulse comes to the end of the preganglionic nerve terminal, the calcium efflux into the preganglionic nerve terminal causes release or efflux of acetylcholine into the synaptic cleft, and these released acetylcholine then act on its receptor located at the postganglionic membrane and then causes physiological response, that is intracellular response. There is a specific enzyme called acetylcholine esterase. This acetylcholine esterase enzyme causes breakdown of acetylcholine, physiological action, and this breakdown of acetylcholine by acetylcholine esterase manage or control the optimal level of acetylcholine in the synaptic cleft and thereby control the optimal function at the level of postganglionic membrane. With this background knowledge, we can classify the cholinergic agonist drugs as direct acting and indirect acting cholinergic agonist drugs. Now, who are the direct acting and who are the indirect acting? Direct acting drugs are those that act directly on the receptor level. The direct acting drugs are those that act on receptor, and the direct acting drugs are ligand. They act just like acetylcholine on the postsynaptic membrane. And indirect acting drugs are those that act by binding and inhibiting the acetylcholine esterase enzyme and thereby decreasing or preventing the breakdown of acetylcholine, leading to high level of acetylcholine in the synaptic cleft and thereby increasing its action on the receptor level. Now, who are the direct acting drugs and who are the indirect acting drugs? I have put some mnemonic to recall the name of the drug just in your exam hall or before your Viva board. The direct acting drugs you can recall in this way: the big money pimp, B for bithynicol, M for money, M for methacholine. From this methacholine, you also recall the carbachol, another drug of this group, carbachol. Then PIM, pilocarpine, the prototypical drug of this group. Now, the indirect acting cholinergic agonist drugs. The mnemonic is here Mr. and Mrs. P. Dane. Mr. and Mrs. P. Dane. M for memantidine. R for rivastigmine. M for malathion. You also can recall from the name of malathion, there are also another agent, parathion. Parathion. Malathion, parathion. Next, serine. P-den. P for physostigmine and pyridostigmine. Here is the physostigmine, another prototypical drug of this classification. Then D for donepezil. E endrophonium. N for neostigmine. This neostigmine, another very important and clinically used drug of this classification. And then T for tacrine. This drug tacrine now not in clinical use due to its toxic effect, hepatotoxicity. So this is all about the classification of cholinergic agonist, the direct acting and indirect acting. A direct acting, the big manicpene, bithanicol, methacholine, pilocarpine. And indirect acting, Mr. and Mrs. P. Dane, memantidine, rivastigmine, malathion, serine, physostigmine, pyridostigmine, donepezil, and endrophonium. Neostigmine and tacrine. The next video will be related to cholinergic antagonist drug. Thank you for your patient watching. If you think this video is helpful for you and other undergraduate and also postgraduate student in medical science, you may subscribe my channel. Thank you very much.